Hey guys, it's Dave. Today we're going to talk about adrenal insufficiency. Now that is different than adrenal fatigue, which you may have heard of. Adrenal fatigue is actually not an accepted medical diagnosis. Proponents claim that it is a mild form of adrenal insufficiency brought on by a sustained amount of stress over a longer length of time. However, again, adrenal fatigue isn't an accepted medical diagnosis. Not saying it's not real. In fact, a lot of the things that I've read about it, heard about it, I actually could agree and see that it should be a diagnosis. But adrenal insufficiency actually comes from a decrease in the production of hormones secreted by the adrenal glands, or actually from the pituitary gland, a malfunction where it's not putting out the signals to the adrenal glands to put out the adequate amount of hormone that is required. These hormones include androgens, glucocorticoids, or mineralocorticoids. And what happens when you have adrenal insufficiency? You can see depression, weight loss, skin pigmentation other than your normal skin color that happens, fatigue, a decrease in sexual desire, as well as just a desire to get things done that you may have had. GI issues, you may see constipation, you may see more likely diarrhea, nausea, vomiting, lightheadedness, a loss of body hair. So not necessarily on your head, but other areas of your body where you may commonly have hair, like on your legs, your armpits, things like that. You'll have a loss of that. Severe weight loss, and not the good weight loss. It's when you're not trying to lose weight and that weight just is coming off and you're not able to keep it on. Headaches and body aches, as well as a significant decrease in your blood pressure. That is one of the most telltale things that you'll see, is a decrease in the blood pressure that normally you may have hypertension, or you'll just be in the normal range, but no, all of a sudden you get a drop in blood pressure, which can cause a lot of those symptoms that I said, like the lightheadedness, the dizziness, the depression, and fainting may also occur. The causes of it that they've linked to it, number one, idiopathic. They just don't know why it happens, but it happens. Another thing can be congenital. You were born with a defect in your adrenal glands or in your pituitary that's causing an issue where they're not putting out the hormone or enough hormones that you need in either the androgen, the mineralocorticoid, or the glucocorticoid to keep up with your body's daily use. It can be from a serious infection, not a mild one like a cold, or even what we've seen so far, not even COVID, but something like tuberculosis or CMV, or something more serious than that it really knocks out your entire adrenal system. It can be from chemo or radiation treatments. That can cause a malfunction of the adrenal glands, so that can knock it out. It can be from a tumor on the pituitary or the adrenal gland. So you want to get it checked out if you have any of these symptoms, because it can be from an underlying cause that you may not see for a longer period of time. It can also be from a hypercoagulation state. So that can cause issues for you as well. Some meds such as rifampicin or anticonvulsants can cause problems with your adrenal glands. If you see any of the issues that I'm describing, you want to talk to your doctor about it. If you're on any anticonvulsants, they may need to change you up to still give you seizure control but not have the issues that we're describing. Extended steroid use can cause these issues because your body becomes kind of dependent on that steroid, so your adrenal glands don't put out steroids like they should, which can then cause the problems that we're describing. Secondary to that, if you've been on steroids for a long time and are coming off of them, if they bring you off of them too quickly or they don't taper you down, it can cause problems with adrenal insufficiency from withdrawal of steroids. The way that you really are diagnosed for adrenal insufficiency is by special blood tests that they can run, including a cortisol challenge. Really, it's not hard to do. You want to check it out for your insurance as far as coverage, but they will be able to diagnose adrenal insufficiency through this, and then treatment will depend on what kind you actually have. If you have an androgen insufficiency, they can treat you with DHEA. If you have a mineral corticoid deficiency, they can treat you with a drug called Florinef or fludrocortisone, 0.1 milligrams once a day. It's an easy treatment. You need to take it with some food. If your glucocorticoids are low, they can treat you with dexamethasone, which is a steroid, hydrocortisone, or prednisone, both of which are steroids as well. You want to make sure you take them with food. Being on vitamin D as in dog or vitamin C would be a good idea because they do lower your immune response. But you can get back to having a normal life in doing that kind of treatment. What you really want to watch out for is letting it go, because what can happen is an adrenal crisis where you can pass out or your blood pressure basically just drops out, and you need to go right away to the ER, because your treatment will include IV steroids and fluids to get your blood pressure back up where it needs to be and to be stable. But literally, it can kill you if you do not get yourself treated for this.